I'm really excited to be with you here today. As Philip said, I'm Angie Lindsey. I'm an associate professor in the Department of Family, Youth, and Community Sciences, and I'm also with EDEN, which Philip did a great job with that acronym, which is the Extension Disaster Education Network. So a lot of my work is in disaster work and in looking at preparing for, mitigating, responding, and recovery from disaster. So I'm really excited to talk to you about a project that we have just recently been awarded here at the University of Florida, and actually doing a collaboration with FAMU, and I'll talk about that in a minute, where we're actually going to do a photo voice project to look at some of the recovery needs and gaps from recent hurricanes that have impacted our state, including Hurricanes Ian and Idalia. This has been a project that has been funded by by USDA NIFA, which is the National Institute of Food and Agriculture. And it is what's called a rapid response grant. And what that means is basically from a natural disaster, if you've identified needs in your area, it was a grant that we wrote based upon some of the needs that we knew from past storms that were going to be something that our communities were going to be recovering from. And so we wrote this grant to try to obtain some research regarding recovery efforts, but then also how do we take that research to practice and basically take that information to fulfill some of those gaps in need. So I'll go ahead and get started here. And as Philip said, this is going to be a little interactive. Those of you who know me know I love the Mentimeter and the Miro. So I'm going to have y'all do a little bit of work here in a few minutes. Nothing hard, I promise. So just to introduce you to the team, myself, and then Dr. Krista Court, who is the director of our economic analysis program here at the University of Florida within IFAS. She actually works really closely with me on determining the economic impact of a lot of these storms on our communities and our ag communities as well. Kimberly Davis, who is with FAMU. She's been a wonderful partner, and she's got a great background in emergency management as well as disaster education. So she's been a great partner with us. Dr. Tracy Irani is also partnering. Dr. Ashley McLeod-Morin, who is actually the communications director for the Southeastern Coastal Center for Ag Health and Safety. And then David Outerbridge, who is the county extension director in Lee County. And there's lots of other folks that are involved as well. These are the main PI folks, but we have a lot of key personnel that are working on here as well. And want to thank those folks for being part of this project also. In addition to some of the folks that I just introduced now, we do have an advisory board. We do have a neuropsychologist consultant who is part of the project team, as well as Dr. Heidi Radunovich. I know many of you probably know her, works with us in FYCS and is a clinical psychologist, extension professionals, and then we're also working with a couple of mental health nonprofit organizations as well as advisory board members. So just to kind of recap the particular storms that we are actually focusing on for this particular project, and I'll be honest in saying that we actually wrote this after Hurricane Ian, and just because of some different things that happened in making sure that the grant had gone through and then getting response from the funder regarding it, Idalia had happened. So I did go back to the funder and say, can we now add in Idalia? And they said, absolutely. So this one was added later, after we were able to secure the grant. So Hurricane Ian was in September of 2022. It was a Category 4, came in Southwest Florida, right there at Costa area. Max sustained winds were 150 miles per hour, and it was tied for the 5th strongest on record to hit the United States. Idalia, our most recent hurricane that impacted our state, was a Category 3, hit the Big Bend area of Florida, which is an area that had not been impacted by a major storm in quite some time. Max sustained winds of 125 miles per hour. And there were many rural communities within this area also that were impacted. So then now comes the fun part. We're going to do some Mentimeter fun if any of y'all have ever been involved. So these are the instructions. If you've got your phone nearby, just take the QR code there and it should take you right to the area where you'll be able to answer some questions. And if the QR code doesn't work for whatever reason, I really hope it does. You can just do the menti.com, and that code right there should get you where you need to be for this particular part of the thing. So I'll just give about 2 minutes for that one, or about a minute, sorry, for everybody to get onto that one. Hopefully you did. There's actually a thumbs down there if you've been able to do it. There you go. Somebody found it. So if you are able to get on, just give me a quick thumbs up there on the bottom. So it should show up on your phone or however you're accessing it. So good. I see some people are being able to find it. Awesome. Thanks, y'all. We do so much virtually now that I like doing things like this because I think they're keeps it somewhat interactive. Trying to keep Zoom a little more interactive and get people involved. So okay, I'm gonna move ahead. Hopefully everyone's been able to jump in. We'll go to our first question, which is what impacts from storms have you seen in your communities? We've been impacted by Hurricane Irma, Hurricane Michael, Hurricane Ian, and Hurricane Idalia. Then, in addition to some tropical storms and some smaller named storms, a lot over the past 10 years. So just take a few minutes and tell me some of the impacts from not necessarily these storms or other storms that you've seen in your communities. And these can be anything. Okay. Teresa has repeated saltwater flooding. Thank you. Roof's gone, wind, rain, loss of electricity, property loss, lost wages, school closure, dead trees and landscaping, mental health impacts. Absolutely. Agricultural loss, some good ones here. Thank y'all. Lost vehicles. Yes. Oh, Wayne, the code is right there on top. You'll see it says join at mentimeter.com. Use code 92828869. It's right there on top. Here, I'll put it in the chat as well. There we go. Awesome. Agricultural loss, block roads, lost wages, barges crashed. Great. A lot of good ones here. A lot of impacts. Thank you. Okay, looks like everybody has added in their information. So we'll move to the next one. Sorry. So a lot of you put this in there regarding some of those community impacts, the things that we see in our communities after these storms come through. And it can differ based upon the type of storm and where the storm was and the location. So thinking about how some of the impacts of these different communities, a lot of factors come into play, including the location. Where did the storm come in at? What part of the state is it actually impacting? The type of disasters. I mean, often we're Floridians, so we think of these tropical systems a lot because we are impacted a great deal from them. But even, I mean, it's interesting when I was doing some presentations in other parts of the country right around the time of COVID. Some folks said, "Well, we haven't been impacted by a disaster in a while," and I was like, "We're all living in a global pandemic." So, even those biological disasters, then you have your technological disasters for those that are Floridians. That would have been, excuse me, the Deepwater Horizon oil spill. And then you hear of some of the human caused disasters, unfortunately, like what happened in Kansas City with the shooting. So there's different types of disasters that will impact those recoveries within these communities. It also includes the extent of the damage and the devastation from these particular disasters. And then the compound and cascading events or something, excuse me, But I wanted to kind of focus on compound disasters. One of the best ways I can describe compound disasters is, how do you prepare for a hurricane in the middle of a global pandemic? So it was like we had preparing for a hurricane while we were also dealing with a global pandemic. How does that look in sheltering? How do we do, do our distancing and try to keep people safe while also trying to keep them safe from a hurricane? So you have that compound disasters. There's two things going on, and then cascading events. And some of the things that y'all put in the word bubble absolutely talk about this, of those things that happen, that tend to happen after other particular storms come through. So we have possibly Hurricane Katrina was a good example of folks that were hit by the hurricane, and then they had the cascading event of the flooding, which we talked about. Several of y'all mentioned flooding as well, but then also talked about folks that were leaving the area as well. So it was cascading events that were caused by a first event. Breakup of communities often happens. People a lot of times will leave the area, especially if there was some major disaster. And then uneven recovery, parts of areas that have uneven recovery. I tell the story of Hurricane Irma, where there was some areas that had a lot of the agricultural workers in one area. And so therefore they didn't have access to some of the resources that some of the urban areas did. So even though they weren't that far apart, there's a lot of uneven recovery based upon resources and those access to resources as well. And you see this a lot in some of our smaller communities, and a lot of the urban versus rural areas as well. So. And talking about a little bit about community impacts and also some of the community response. And I'm sure we have all seen this. Excuse me. It kind of starts with a heroic. And I think we've all been there. Like the first thing you do, I know in our neighborhood, after a storm has gone through, somebody comes through with a chainsaw and says, "What can I help you with? How can I help get this tree off of your driveway? What can I help you do? Oh my gosh, you've got a tree leaning here. What can we do?" So it's very much so heroic. What can we do to help each other? We got to come in as a community. And that leads to the honeymoon stage of, oh, I love my community. I love my neighbors. I love the people I work with. We've all come together in the time of crisis, and we've come together to try to help everybody. And it's a honeymoon phase. And then as you get further away from the actual disaster, you get a little bit of disillusionment. A lot of times this tends to happen when you start trying to deal with the insurance, and trying to figure out, well, what do we do next? And how do we make a claim? And so some of that disillusionment. And then lastly is the recovery and restoration. So I want you to think for a few minutes about these four areas. Which community response do you think is the longest, takes the longest in the community, typically? I know every situation is differently, but typically, what do y'all think? And so another quick little Mentimeter here. And the longest would be which one at the highest ranked, basically. So number one, which one do y'all think would be? Disillusionment, okay. Recovery and restoration. Couple more minutes for folks to maybe log on. There we go. Honeymoon phase. Okay. Great, thank you. Oh, some of them. Somebody changed their answer. Okay. Awesome. Well, I don't see a lot of movement right now. But yes, no surprise that recovery and restoration definitely comes up on top. And I would absolutely argue as well that a lot of these probably have some overlap. And there's probably a lot of disillusionment, the company, the recovery and restoration. And then there's definitely some heroic that bleeds into those next those responses as well. So, but recovery, as we know, takes a really long time. And I think sometimes the longer the recovery, you could still have the disillusionment of, are we ever going to get back to normal, or trying to get used to a new normal? But understanding that this recovery takes a really, really long time, was one of the reasons that we decided to look into a project like this to understand the further away we get from these events, from these tropical events. What does recovery look like? How is recovery perceived within communities that have been severely impacted? And so that was something that we really wanted to look at, is to understand, response. Everybody's there and you're working and you're there. And then what happens 6 months later? What happens 8 months later? What happens a year later? We know recovery takes a long time. So just really trying to understand perceptions and understand what that recovery does look like long term in some of these communities that have been heavily impacted. So just want to talk a little bit about what leads to better outcomes in communities. There's been some research that kind of looks at how do communities bounce back, or that maybe you've heard that word resilience. It's become a big word now, but I like to think of resilience of the ability for communities to bounce back or bounce forward after an event. What is something that they value, and how quickly can they get back to that after something happens? And so what some of the research has told us is that a lot of times that positive outlook and comforting beliefs of community members can lead to better outcomes, as well as support networks. And I didn't really get into it here, but I mean, we think about those bonds, the bonds that we have with our really close folks in our neighborhood, and those that maybe we attend church with, or have groups with, or our kids can go to school with. But then also making sure that you have those bridges, and those folks are maybe the folks that are out of your community, or maybe even out of your state as well, that offer support. And then there's also linkages when you're thinking about communities and different organizations, of how are they linked to folks that can maybe make policy change within the communities as well. So if you want more, I don't need to go down a rabbit hole with that, but there's a lot of information regarding support network of those bonds, bridges, and then links as well, providing support, especially after disasters as well. High self-esteem, obviously open and supportive communication. It all comes back to communication, being able to talk about it. And I think a lot of that comes into when you're talking about some of the mental health impacts. The adaptability, the ability of folks to be able to adapt quickly to that new normal. We know a lot of times these events can bring about, maybe it won't get back to normal, but a new normal, and the ability of community members to actually adapt to that new normal as well. And then the resources that are available to communities. And obviously this can change based upon the location of a community, and also based upon that urban and rural designation as well within those communities. So we kind of had some research on what leads to better outcomes in communities after these disasters. So kind of putting it together with this particular project, we wanted to understand what the gaps and needs were, but then also find out what those gaps and needs are, try to meet those with some of the resources that we have available to us here at IFAS, as well as some of the relationships that we have with other organizations, service organizations, and regulatory agencies as well, to help communities bounce back, to help them adapt to the new normal as well. So basically trying to provide some tools to provide some of these areas provide some of these tools to help communities bounce back. So what is photovoice? So I haven't really gotten into, we're collecting this data through a photovoice project. So I'm not terribly new to a photovoice project. I actually have worked on one before, but this is the first one that we've actually kind of done from the ground up. So pretty exciting. And it is participatory research, meaning that the individuals are heavily involved in the research. And participants utilize photography to show their community. So to show their impacts in their community and show what they believe the perceptions in their community. Obviously, these photographs can be very personal. They can share an experience. They can tell a story. We know that photographs can tell 1,000 words. So it can be a very personal story that these photographs can tell. Usually with these types of projects, there is a focus group as well that allows participants to provide additional detail about the photographs that they put in as well. So in addition to sending in a photograph with a caption of what is going on here, they have the ability to join a focus group after the pictures have been collected, to kind of talk about why they chose this image and why they decided to submit it. Photos are used as data. So they are used completely as data, and they are analyzed to determine some of those gaps and needs. And I know I mentioned earlier that we had two neuropsychologists, and then there's also a clinical psychologist that are part of the advisory board. And one of the reasons that we really wanted to have them on there is to determine some of the mental health impacts that may come out from these images and analyzing them. So that was one of the things that we definitely wanted to have some of those folks on our advisory board for that. But they are absolutely data. So just real quick, does anybody have any experience with photo voice projects? You had been a participant or have led one before? No? No, not a lot of folks. Okay, great. So it's a new experience. Awesome. Thank y'all. And it's a new experience for us too. So thank you. We're happy to all learn together. Absolutely. So I just to kind of tell you, since I've kind of told you kind of the background of how we developed the projects, just to give you a little bit of kind of the breakdown of the actual project. We have three particular aims. And the first is we really want to understand those agricultural communities that were hit hardest economically. And so again, I mentioned earlier that we were working closely with Dr. Krista Court, and she is amazing. And she's been working with us to kind of narrow down those particular communities, those ag communities that have been impacted heavily by these particular storms, particularly Hurricane Ian and Hurricane Idalia. We're working now on the economic analysis in addition, so targeting those particular areas and then putting the recruiting information back out to those particular communities and also publications based upon the information that we receive. The second aim is to increase knowledge of those in those impacted Florida agricultural communities regarding resources that can meet the needs and assist them with work through the recovery process. We'll do that through analysis of photographs, the focus groups that I mentioned, webinars and resources that we hope to develop based upon the results that we find from these particular photos. And then again, publications also. And then lastly, optimize some collaboration between local extension as well as local, state, and federal agencies during recovery to implement an active evidence-based support referral program that best meets the needs that have been identified by these particular communities. We've been very lucky and very privileged to have some close relationships with a lot of our local, state, and federal agencies, as well as some nonprofit organizations and those that offer services within the communities as well. So just hoping to make sure that we link folks with these particular areas and these resources that may still be available for these long-term recoveries from these storms. So just quickly kind of going through kind of our timeline. This is only a year project, so we hope to be done by the end of the year, or actually probably a little bit before the fall of next year. So we're hoping to kind of conclude things for the funder probably around September, October, but we plan to continue to do some work with that probably till the end of 2024 as well. And just wanted to show you again, Dr. Krista Court is amazing. But she's already developed some preliminary economic analysis. This is from Hurricane Ian. You'll see there on the left the affected agricultural lands. There, the red parts and the orange parts there on the left-hand side. And then overlapping that with the counties there on the right-hand side with that particular map. From that area, we were able to designate some of those target counties on the left, including Hardee, Manatee, Sarasota, DeSoto, Polk, Highlands, Glade, Charlotte, and Lee County as well. And then moving to Hurricane Idalia, same thing. She did the Hurricane Composite Intensity Index with the left there. And then interestingly enough, when she sent this to me, I was like, there's impacts from that in the same counties that were impacted from Hurricane Ian. And yes, indeed, with some rain events and some rain impacts and wind from Hurricane Idalia moving up in that area like that. So again, they kind of got a double dose down there. But looking specifically at these particular counties, Taylor, Madison, Hamilton, Suwannee, Lafayette, Dixie, Gilchrist, Levy, Columbia, Baker, Union, and Jefferson counties from Hurricane Idalia. So anticipated outcomes and products. Obviously, Dr. Court's going to kind of finalize some of those maps that I've just shown you now to really show some economic impact maps. I know she's been working on that already. And we're also starting to pull together some recruiting materials. So we have some amazing folks here at the PI Center that are able to kind of put together this image that you see here to the right that we hope to use in some of our recruiting materials. We really hope to have this launched by the end of this particular month, and then possibly an EDA series, which is our electronic database of information system here at IFAS, that kind of talks about the photo voice process. So just talk about our process of going through this. So lessons learned, and hopefully folks that are planning to do photo voice projects in the future can learn from some of the things that we've learned. Academic publications obviously would be a product, and then product development and delivery, including some of those toolkits, webinars, resource fact sheets based upon the research results of what we find as well. So recruiting is going to be a big thing with us, obviously, and hoping that folks will actually participate in this particular project. So what we're currently working on is finalizing recruiting materials with our IRB. And so we have to make sure everything's squared away with them before we start putting recruiting materials out, but we're close. We're very close to getting everything finalized. So originally when we wrote this particular project, we only had for this to be for adults 18 and over to send in photos of what recovery looks like in their community. And then actually Kimberly Davis, who works with FAMU, she works a lot with youth, and she said, you should open it up to teens too, because they have phones. And I have teenagers at home, and I said, that's a brilliant idea. So we have opened it up to 2 groups. So one would be that age 13 to 17, and then adults 18 and over as well. And recruiting materials are simply going to ask, what does recovery look like? What does recovery look like in your community? A very generic question, a very general question to allow for people to interpret that how they want to. We do plan to have flyers as well as social media, talking points for any in-person meetings, especially for extension that may be interested in partnering with us. And I'm open to ideas. So feel free to put stuff in the chat. Send something to me later. We are open to ideas of recruiting folks to take these pictures. And then I also put a QR code there that just goes to a form that we will let you know as soon as we have been given the all clear from IRB to start recruiting. If you are interested in being part of the project, or if you know someone else that may be interested, please just give me your best contact, whether that's an email or a cell phone that we can send a text to, and we'll be happy to make sure we connect you with those information and the materials for that. So the last time I'm going to have y'all work here is any feedback, suggestions, questions, anything that I can answer offhand, or feel free to write it in the chat too if you're not comfortable with Mentimeter. I completely understand technology is not always my friend. So, but I thank y'all so much for being with me today and learning more about this project. And I'm happy to answer any questions and just appreciate y'all being here. So thank you.
Well, thank you so much, Dr. Lindsey. I will once again reiterate that if you do have questions, you can use the chat box, you can use the Q&A. Maybe you just want to share a story or just a quick little excerpt about some of your experience in some of these storms that we've had in recent years. Please do that. And then, of course, I also wanted to say that the QR code for that Google form, I will make sure to include the link in our follow-up email as well. So if you missed it, everyone who registered will get that link in an email. And to Dr. Lindsey's point, I would encourage you to send that to anyone that you think would be interested in this. It's a great opportunity to really have our voices heard right through photos, hence photo voice. So if you have any questions, there is one question from Carrie Stevenson. Will there be a social media component to the images shared? We'll start with that.
Yes, thank you, Carrie. Actually, I was typing back. So yes, Carrie, we definitely have a social media component. In fact, we are thinking about possibly having its own Instagram page. So stay tuned for that. It will definitely be on the Pi Center social media as well as Florida Eden. So if you follow those, we'll definitely have the links for that as well. But again, you can absolutely reach out to me personally if you're not seeing it. But I'll make sure that that we get that information out to y'all. But it definitely will be on the Pi Center social media as well as Florida Eden social media. But I'm kind of hoping that we develop our own as well. We'll see. I have to get approval for that. Yes, Daryl, there will be training and guidelines for photo subjects. Absolutely. So, I mean, we're leaving it kind of open to folks, but absolutely, we're definitely going to give some guidelines to people that are interested in taking the photographs as well. So, oh, sorry, Christine, I just stepped over yours. The community has a sense of PTSD and sort of a lasting shock. Absolutely. And yeah, it's tough. And I think it's, you know, I have been deployed after Irma, Ian, Michael, and Michael now, and being in the communities after a disaster is tough. And then just leaving, and you know that things are not back where they are, and then it's going to take a long time. So I can absolutely understand that it is a lasting shock. So absolutely. Sorry, I'm trying to think these. Oh, Megan asked Philip, there will be access to a recording of this, correct?
Yes, and I was also
Okay.
typing in the chat as well. Yeah, I will
Okay.
send the recording around to everyone who registered, so that includes everyone here. We'll also post it on the Pi Center's website as well as sccahs.org. That's the Southeastern Coastal Center for Ag Health and Safety. So it'll be in multiple places, but you'll be emailed. Yes.
Thanks, Philip. Carrie's question about the participants will be linked up with local community services. Yeah, absolutely. That was one of the reasons that we decided to do this, is so that we could identify maybe some of those gaps and needs and be able to link people with the resources that they need. Absolutely. These are great questions. Thank y'all. And again, I'm open to suggestions, ideas. Please, I'm open to all sorts of things that people are willing to share, or suggestions. That's my email. That's my cell phone. So feel free to text me or whatever. We definitely are looking for input for this particular project and want it to be successful and something that really helps these communities.
Dr. Lindsey, as we're waiting to see if there are any other last questions or comments, I'll just share real quick as we're wrapping up that I'm currently over on the east coast of Florida around Volusia County, and I believe it was in 2022, Hurricanes Ian and I think Nicole really impacted the area. And when you go along the coastline, along the beach, there's still recovery in action right now. And it's, that was well over a year ago now, or over a year ago. So it's amazing how long these impacts, going back to your question and Mentimeter, what's kind of that longest phase. So it's still a big visual, for the residents around the state. And I know Southwest Florida is still very much in that condition as well, I'm sure, from Hurricane Ian. So just figured I'd share that. But yeah, if Dr. Lindsey, if you have any other comments about that or anything else, feel free to.
No, absolutely. And I think I've been to that area recently too, as well, Philip. And I think Nicole being so late in the year, I remember we were like, it's November and here we go again. So, and especially after just going through Ian, it was really tough. So, absolutely. I think you're exactly right. And I think those community members are seeing that every day. So